A dobutamine stress echocardiogram, DSE, is a widely used diagnostic tool in the evaluation of aortic stenosis, particularly when the severity of the disease is uncertain or when there are discrepancies in non-invasive test results. While generally safe, the procedure does carry certain risks and potential complications, especially in patients with severe aortic stenosis or other significant cardiac conditions. Here are the key complications associated with DSE in aortic stenosis. Arrhythmias are a potential complication. Dobutamine increases heart rate and myocardial contractility, which can provoke arrhythmias, particularly in patients with pre-existing electrical abnormalities or structural heart disease. These can range from benign premature atrial or ventricular contractions to more serious arrhythmias such as atrial fibrillation, ventricular tachycardia, or ventricular fibrillation. Continuous ECG monitoring during the test allows for the early detection and management of arrhythmias. The test can be stopped if significant arrhythmias develop. Myocardial ischemia can occur during DSE. The increased oxygen demand induced by dobutamine can outstrip the supply, particularly in patients with coexisting coronary artery disease. This can result in myocardial ischemia, which may manifest as chest pain or ECG changes. If ischemia occurs, the test is typically terminated and the patient is treated as necessary, potentially with anti-anginal medications or further cardiac evaluation. Hypotension is another risk. In some cases, dobutamine can cause a significant drop in blood pressure due to its vasodilatory effects or due to the worsening of outflow obstruction in severe aortic stenosis. Patients may experience dizziness, lightheadedness, or fainting. Blood pressure is closely monitored during the test, and the infusion can be stopped or slowed if significant hypotension occurs. Dobutamine can also cause hypertension. This is due to its inotropic and chronotropic effects, particularly in patients with autonomic dysfunction or pre-existing hypertension. Elevated blood pressure may increase the risk of stroke or other complications, particularly in hypertensive patients. The test can be paused or stopped if blood pressure rises excessively, and antihypertensive treatment may be administered. Acute heart failure is a serious complication. In patients with severe aortic stenosis and reduced left ventricular function, the increased workload induced by dobutamine can lead to decompensation and acute heart failure. Worsening dyspnea, pulmonary edema, or symptoms of congestive heart failure may develop. The test should be immediately stopped if heart failure symptoms occur, and appropriate medical management should be initiated. Severe angina can be provoked by the increased myocardial oxygen demand during DSE, especially in patients with coexisting coronary artery disease. This can result in severe, crushing chest pain, often radiating to the arms, neck, or jaw. Immediate cessation of the test and administration of anti-anginal medications, such as nitroglycerin, are required. Further cardiac evaluation may be needed. Although rare, bronchospasm can occur, particularly in patients with a history of asthma or chronic obstructive pulmonary disease, COPD. Bronchodilators may be administered, and the test should be stopped if significant respiratory symptoms occur. Stroke is a serious but rare complication. The increase in blood pressure and myocardial contractility during DSE could theoretically increase the risk of stroke, especially in patients with a history of cerebrovascular disease or uncontrolled hypertension. Sudden onset of neurological symptoms such as weakness, speech difficulties, or facial drooping requires immediate cessation of the test and emergency medical intervention. Exacerbation of outflow obstruction is another risk in patients with severe aortic stenosis. The increased contractility induced by dobutamine can exacerbate the outflow obstruction, potentially leading to severe hemodynamic compromise. This may result in severe hypotension, syncope, or sudden cardiac arrest. The test should be terminated immediately if these signs develop, and resuscitation measures should be prepared. Finally, nausea and vomiting may occur due to the systemic effects of dobutamine, particularly at higher doses. Symptoms can be managed with symptomatic treatment and monitoring. While the dobutamine stress echocardiogram is a powerful diagnostic tool in assessing aortic stenosis, it is essential to be aware of these potential complications, especially in patients with severe or complex cardiac conditions. Careful patient selection, continuous monitoring during the test, and readiness to manage complications are crucial to minimizing risks and ensuring patient safety.